Hello, everyone, and thank you for joining our event today, Equitable Healthcare Measurement Supporting Community Voices, Systems, and Partnerships. Let's get it started. So I am Desiree Collins Bradley. I am the Patient Engagement Network Lead at ATW Health Solutions. And ATW Health Solutions is a Chicago-based healthcare advisory and consulting firm. We use a data-driven, evidence-based approach to make healthcare better by focusing on quality, safety, and most importantly, health equity. Over the past year, we've been working with the Robert Wood Johnson Foundation pretty closely to really look at healthcare measurement, making sure that what can we do to make it more patient-centered and equitable and transparent. You can go to the next slide, please. So why are we here? Why have we all come together to this webinar? We've come together to hear from local leaders. You'll hear from some community partners to really think about what can we do to make this healthcare measurement ecosystem more patient-centered. You're going to hear insights, and we hope that you're going to leave in action. We're going to share with you our findings, our research findings, and examples that kind of bubbled up from the project. And again, we want you to leave in action. And so you can go to the next slide. So as we are going through this webinar and you're hearing insights from our community partners, we want to make sure that you're laser focused on the focus. So we have a question for you to run on, and I'll tell you, get your notebooks out, take notes. We urge you to drop your insights and your questions in the chat. But as you're hearing from our speakers and you're hearing about the project, in your role, what actions can you take to include patients and communities as equitable partners in the healthcare measurement ecosystem? So again, I urge you to drop those questions in the chat and insights, and we'll have some time at the end for some Q&A and sharing. So you can go to the next slide. So I am very excited to have a guest speaker, Dr. Bryan Buckley, with us. And I'll say, when we were pulling this webinar together, and I was speaking with Dr. Washington, our CEO and founder, and I said, who can we get to really bring us the head to the heart of the work and really level set us around this healthcare measurement ecosystem? And she said, I have the perfect person, Dr. Bryan Buckley. So I'll give you a brief kind of bio of Dr. Bryan Buckley, and then I'll turn it over to you. So Dr. Bryan Buckley is a health equity focused and systems oriented leader in health delivery system redesign, performance improvement, and change management. He is currently Director of Health Equity Initiatives at the National Committee for Quality Assurance. Most of you know them as NCQA, where he supports NCQA's health equity strategy across multiple departments to better integrate health equity concepts into existing programs and projects. He was born and raised in Maryland and is a first-generation American citizen with immigrant parents from Antigua and Barbuda. We've asked Bryan to kind of kick off today's event by providing brief comments from where he sits of the state of healthcare measurement and why this topic is so important. So Dr. Buckley, I'll pass it off to you.
Thank you there, Desiree, and thank you, Dr. Washington and team for the invitation. And it's a pleasure to be here with you guys today. And so as I was thinking about the task that they had me in this really quick 5 minutes of really why is getting community voices so important, something Desiree said, I started thinking about my roots. And I started thinking about my maternal grandmother, which was born and raised in Antigua. And really how everything I learned about as we think about equity and community engagement, I learned a lot from her. As a kid, I would often, when I would go visit Antigua during the summers, she would get all of her grandchildren and we would walk through the community. We're in a rural area of Antigua, and she was a principal and she thought that it's important to hear from the community. And so she would take us on this walk, making sure that we're seeing every single person. So as I was thinking about my story of my grandmother, I started thinking about a framework that I use at NCQA, the 4P framework, which was based off of research from Kimberlin Leary from the Harvard Kennedy School. And it stands for perspectives, process, people, and projection. And I started thinking about the story of my grandmother in that regard. So the first part is perspectives. It's the idea that my grandmother knew she had the humility to know she cannot see everything. And for us to really truly see what's going on in the community, we have to listen to our communities. We have to hear from each and every one of them on what's the pebble in their shoe. And so that is something that I really encourage as we talk about the action in your role, making sure that you are talking to many different people to understand that community context and that community perspective. The second part of the P is process. And there's such a privileging with process. And even in her process, she knew she couldn't just talk to one part of the village. She had to make sure she was really making sure she was putting a broad net to understanding each and everyone's perspective, making sure that she could capitalize on the diversity. And we often hear every system is perfectly designed to get the results it gets. And often patients and communities are often not engaged. And so there's even a privilege of processing as we think about measurement, as we have to reimagine how we think about measurement, but also asking ourselves, who are we centering the measurement on? How are we utilizing community members, patients, and families in the co-design, the co-development, and the co-delivery of a lot of great metrics? The third P is people. And for many of the folks that are on the phone, you're all coming from different areas within the healthcare ecosystem or the health ecosystem. And we all remember, I always think back to your mission. It usually is focused on the person and or communities. And so just remembering that as we're talking about people are emotionally being impacted by the healthcare ecosystem. They're feeling injustice, they're feeling discrimination, racism. And so it's important as we are doing this work and you are looking at how you can cultivate that collective community intelligence, that you have that in mind, that persons are at the center of how we are doing this work, and the greater community that they live, work, and play in plays such a big part into how they actually think about their health. And really changing that concept from not doing something for the community, but with the community, making sure that they are an equal partner in that power sharing and trust building. And then the last is projection. What's the story we're going to tell about ourselves of how we tried to create a more equitable, just society to help improve the health and well-being of where people live, work, and play? But the more important question, as we think about your role, your action, is what's the story that the community and your patients will say about you on how you tried to partner with them, how you tried to work with them, how you tried to create and address injustice, how you tried to make things more equitable, how we really tried to create this more collective impact in the work that we do. And so as you go into hearing the rest of my wonderful panels of speakers today, think about that 4P framework of perspectives, process, people, and projection, because it is so important. And I would like to close off with a very common quote that we say in Antigua that I learned from my family, and I think it speaks to the essence of this amazing dream team that you're going to be hearing from, is many hands make light work. And the meaning of that is that it requires all of us, no matter where you are within the health ecosystem, it's going to take all of us to build that collective action to really make an impact into where people live, work, and play. And so with that, I want to thank you all for coming to this wonderful webinar. Thank you for the funders that have supported this work, and I'll pass it back over to you, Desiree.
Thank you, Dr. Buckley. And I'll say, I wrote your 4 Ps on a sticky note, and I'm going to stick that on my board with the others. And one of the things that really resonated with me is that co-design concept, right? We got to have the patient and families and community partners integrated into this work to really co-design what they need, they want, they hear. So thank you for adding that context. And I love hearing about your grandmother, how she kind of pollinated herself around the community, as many of us do even now today. So thank you so much. So I kind of want to share with you about the project and some of the findings that we found. So we interviewed many different community-based organizations, community leaders, and I'll be honest with you, they were very transparent, very open of what they needed, what they wanted to hear, and we're so grateful for that. The Robert Wood Johnson Foundation really supported this project and was very open to hearing. We want to hear from the community, right? Everybody that has been touched by the healthcare measurement ecosystem. And so some of the themes that kind of bubbled up into after we did those stakeholder interviews were the project findings that you see before you. And so measures, we're here talking about measures. Measures are needed that acknowledge the past harms. So you have to know and really acknowledge what has happened in the past to know where we're going, right? And so create accountability. We want to have that measures that are really created, that accountability piece. Measure systems level equity. You know, equity has been a buzz, and we all know since COVID-19 has been equity, equity, equity. But how do we measure system level equity effectively? Have measures that are transparent at every stage of the work. Include qualitative data. Capture those biases, microaggressions, and disrespect. Have measures that report racial and ethnic disparities. And incentivize providers that close the gaps and address those root causes. Measures that address holistic patient needs. And quantify community assets, connections, and many, many more. And so again, you know, we're made up of many different stakeholders on this call, whether you're a payer, a community partner, a health systems leader. These are some of the findings that kind of bubbled up. So I hope they surely resonated with me, and I hope they resonated with you as well. So we can go quickly to the next slide, and I'll give you kind of like the resources that were produced from the project stakeholder interviews. So now I will say in the chat box, you'll see they dropped a link to the Partnerships for Change project report. I urge you to really take a deep dive into the report. That report also has a key findings overview with direct recommendations that will let you know, in the role that you sit in this healthcare measurement ecosystem, what actions and recommendations can you do tomorrow to drive healthcare measurement in a more equitable patient-centered space. So again, at the end of this webinar, we'll send communications to you, which will include the links to the full report and all our resources. The other resources that were produced from our project was case studies and a call to action video. And so the case studies were with the Asian Health Coalition and Center for Asian Health Equity, Indigenous Lifeways, which you'll hear directly from Krystal Curley in the next portion of the panel, and then NBEC, the National Birth Equity Collaborative. So I urge you again to really use those resources and review those resources. And we ask that you disseminate it, right? Sharing is caring. You don't know what you don't know. These resources will help you think about and shape what you can do. Think about that question to run on. What can you do in your role? So we can go to the next slide. Thank you. So I am so excited to have this panel of our partners. And I'll say, you know, I'm excited about this panel. I know they're super excited. And we wanted to make sure that we have the commitment to community. One of the themes that also came out when we started the project is our community partners were like, okay, so you want to have these interviews, what next? Are you going to pick this information and disappear into the sunset? No, we made a promise to share and let them elevate their voice, and this is that space for them. So, okay, so we're going to start off with Nate Siggers, and I'm going to introduce each one of them. Nate Siggers is the founder and CEO of Great Triumphs, an organization built on improving racial equity, combating the workforce power differential, and creating positive solutions-based decisions. He counts his greatest achievement as being a Williamson, West Virginia native husband, father, and advocate. Nate has spent a great amount of his time in his career helping to improve the community he was born and raised in. And next you'll hear from Carmen Green. Carmen Green joins us from the National Birth Equity Collaborative as the Vice President of Research. She is a published writer, reproductive justice activist, and doula in training. Carmen's continued commitment is to honor her ancestors and future generations by serving Black families. And last but not least, we'll hear from Krystal Curley, Executive Director of Indigenous Lifeways. She is a Navajo Nation tribal member from the small town of Gallup, New Mexico. However, Gallup, New Mexico is known for, most people know them as the Indian capital of the world. Combining both her community engagement and filmmaking experience, Krystal is able to bring awareness to Indigenous issues like alcoholism, mental health, environmental racism, and intergenerational trauma. But before I begin the questions in the panel, I want to share with you just a little snippet of the video, the call to action video that we talked about, that the link will be in the chat. We wanted to show you we can't show the whole video because it's about 6-ish minutes long, but we wanted to show you just a quick little synopsis from Fornessa Randall, who participated in the call to action from the Asian Health Coalition, to show us a clear example of what equitable patient-centered measurement looks like. So we can go to the video now.
We work hard to elevate the voice of the community partners. For example, Chicago has a community health survey that we do every year. One year, they had about 18 Asian responses. We said, we have a connection with the community, with other nonprofits like ourselves, and we really want to do this right. We took the citywide survey and modified it so that it was culturally and linguistically appropriate for different communities. We're bordering 3,000 survey responses right now. We have disaggregated data from 9 different communities, 9 different cultures. We have multiple languages. That's health equity right there, because we provide the voice of our community partners and we're receiving population-based data from the actual population.
Wonderful. And so the reason why I wanted to kind of share this video before we get in the panel is I wanted to kind of ground us with a clear example of, what does that look like in real time, in real action? And so we know we hear data, but this was a clear example of how their response to community and using their data effectively. So now we're going into our panel, and I am super excited to get this party started. So Carmen, I'm going to start with you, if that's okay. I want you to kind of tell me about why community input in measure development is so important from a maternal health and birth equity lens.
Excellent. Thank you so much. I think I can be heard, but can you see me clearly?
Well, I can hear you. Your video is a little distorted, but that's okay. We will keep rolling with it. Do you need me to repeat the question?
No, I'm clear.
Okay,
And y'all are going to get my best anonymous answer until I can clear my face up. Oh, there we go. Again, thank you for the opportunity to join you all. This project with ATW was absolutely fantastic, and it gave us an opportunity to really share transparently what we have been learning as advocates for Black communities and Black mamas. So it's so important for maternal health and for the birth equity lens, because at National Birth Equity Collaborative, we believe that all Black mamas, their babies, and villages can thrive. And so by focusing on frameworks like reproductive justice and human rights and research justice, these are the type of frameworks we employ in our research methodologies, in how we communicate and how we engage with communities, because it requires us, it gives us a real imperative to honor community experience, uplift leadership, and engage them in ways that usually in measure development is not normal. And so those type of frameworks also give us imperative to honor the person. And so with mamas and birthing people, centering the birthing person is so amplified because there's no more embodied an experience of womanhood than becoming a mother. Like, that is just one of the most deeply embodying experiences because it's social, it's psychological, it's emotional and spiritual. And so that's not the type of thing you can kind of surmise into a measurement without consulting the people. And we've learned throughout that journey that starting with patient experience to a certain point is simply abnormal. It's invited, by measurement developers, and also frowned upon because it forces us to use different methodologies and to honor communities in ways that our medical system is not set up to do. So it is just community input is the only way that we believe we can create measures to get to health equity.
Right.
Yeah, thank you.
You're welcome. And you touched on something that kind of really resonated with me, is that community input. Again, I say this, and I say this in my family life: you don't know what you don't know, right? So in order for us to know what we should be measuring, we have to talk to community. So in 30 seconds or less, Nate, anything that Carmen said that you want to respond to, or anything resonated with you from where you sit?
Yes, when you're talking about responding to the community, how can there's a saying, there's nothing about us without us. So how can we do anything to help someone succeed if we don't know where they've been or where they are?
Right. Thank you. So Krystal, I will kind of shift it to you. So my question for you is, Krystal, your participation in this project really shaped the ways in which we think about culture and environment and how that affects measure diversity. Can you share more about what that looks like from your community where you sit?
Yeah, thank you, Desiree, and Carmen and Nate for your comments. My name is Krystal, and I'm just going to speak for my community, but I'm pretty sure it's like the same mentality for all Indigenous people, not just here in the US, but across the world. Mm-hmm. We have an obligation and a responsibility to ensure that our relationship with our Mother Earth and the environment is in harmony. That's what we've been taught. Dr. Buckley said it perfectly, with his relationship with his grandmother. That is something that, we are the matriarchs in our family are like, their word is gold. It's the law. And so, we're centering a lot of our guidance under our grandmothers and the mothers and the aunties and the sisters that we have in our community. So that, and also not only the matriarchs in the family, but also knowing the dynamics of the community and the relationships between family members, the community, and this mindset and this lens that we look through is called it's a kinship system that we have. So this is a lens that we look through at all perspectives and issues that we have in our community, where we have this lens of knowing that even I'm maybe 100 miles away from my own hometown, but I can introduce myself and my clans and know that there's maybe a grandma I'm related to, there's a grandpa, there's an uncle or a dad or a little brother in the audience. So that's how we identify ourselves, and that's how we take care of each other. We know our roles and our purpose in our community. But not only that, we know that our obligation to take care of Mother Earth and that connection, that relationship that we have is like this. It's a symbiotic relationship. You can't separate this type of relationship. So when we're helping a community, you really have to understand the land, the people, understand the relationship. If there's any type of violence, our whole theme is any type of violence against Mother Earth is violence against the mothers. And this is something that we see across Indigenous communities across the world, is that our people and our land are an ultimate sacrifice for energy extraction, for any type of development. So from that, we have a lot of health issues. So we really have to look at our communities in a different type of lens than before. We have to know that the relationships that we have with each other and with the land is still very important. We have to have that at the forefront.
Thank you, Krystal. And so, something you said really resonated with me as well is the fact that you have to kind of embed yourself into the community. And that takes a level of commitment and that trust building piece that we've had many conversations about. So, Carmen, I'll kind of kick it to you really quickly. Anything you want to add to what Krystal said? Any insights or responses to what Krystal just shared with our listeners?
Thank you. The connection that our Indigenous people in this country have to their approach in health equity, with their connection to all things that are natural, connecting Mother Earth to women and mothers in the community. I mean, those type of connections we have to make space for in measured development. And those are just quick examples of the same sentiments that are rejected by, large institutions, the same institutions that approve and scale these same measurements.
Wonderful, wonderful. Yeah. And again, there's a whole layer of trust building that needs to be done, because historically, communities that I say marginalized communities, there's a level of mistrust there. So you got to show that level of commitment to the community to show, okay, what matters to you? You don't know what matters to them until you actually have a conversation with them and include them into that co-design. Dr. Buckley said a word, co-design, in his remarks. And I can't tell you, we heard that through all the conversations that we had with the different partners that kind of spoke to us during this project about co-design. Like Nate, you said it, do not do anything about us without us. And so, Nate, I'm going to kind of shift it to you in this last question. I want to hear about tangible ways to really develop equitable partnerships. What are one or two things that are most important when we're thinking about, we know we need to speak to the community. What are some things that we can do to really make those equitable partnerships kind of grow and foster? Any examples that you want to share with us?
Well, I feel that the most important partner is the people that you want to serve, the people you want to help. Those are the partnerships that to me are the most important. So I just want everyone that's listening to me right now, think about your profession and what you do, right? With the education you have, the studying you've done, all the trainings you have to be in the position you are now. And someone just randomly comes up to you and tries to tell you a way to do your job better or to be a better whatever you are. How would you feel about that? So it's kind of the same way that a person that you're trying to help, a community you're trying to serve, that you go and tell them what they need. Like I said a minute ago, there's nothing about us without us. I feel that it is my duty as a person. I don't share this a lot, but I'm gonna say this on here. I'm a person in long-term recovery. So I feel that it is my duty, because of where I've made it to in my life. It is my duty to help people that are in recovery or struggling with addiction. I feel that I can identify with them. I know their struggles. I can build a relationship of rapport and trust that a person that's not been in those shoes can. And I feel that even though sometimes we feel really far removed from a situation, really far removed from a struggle, that it is our duty to dig down deep inside. If we really want to put our money where our mouth is, we need to go back to that feeling. We need to share with people. We need to be open and honest. And then I think that change and growth can happen.
Ooh, you dropping the knowledge on us, Nate, today. That level of transparency. And again, that peer-to-peer support is so important. So for those measure developers that are listening, hospital leadership, payers, funders, everyone that touches this healthcare ecosystem, we challenge you to really look outside of the box and, you know, integrate yourselves into the community. And if you're not there yet, go to our, you know, Partnership for Change report, because there are tangible examples of what you can do to make that a reality. So I will get some reactions. Krystal, I'll go back to you. You know, any reaction to what Nate has to say, anything you want to add?
You know, I think that building the trust is so important. You know, there's, you know, it's like time's up with doing everything without us, without our consent, without our say, without any type of conversation or notice. It's always without us. And I think, you know, that's something that Indigenous people can really align with, is that even speaking about healthcare systems, Indigenous people, a lot of us, we depend on IHS, the Indian Health Services, and a lot of their decision making and a lot of different policies that they're federally funded under, we don't get to have the reproductive justice that we need at the when we're able to go to the OBGYN. You know, there's so many different things that have pretty much have gone through without any type of conversations with community. And I think that, you know, just goes with any type of decision and any type of community that you go into. You really have to make sure the people that are going to be having, I don't want to say bear the burden, or that, you know, that have to deal with these daily struggles of literally trying to live and survive each day. We're going to have to make sure that we're doing it in a just way that is with dignity as well.
I love that word, with dignity. That is so, so, so important. And I know that resonates with you, Nate, because, you know, I have family that are in active recovery. So I know what that looks like. Although I've not walked that journey, I appreciate persons in your role that can connect with them and walk that walk with them. So thank you for being so transparent and sharing that with all of our listeners. And I see they are blowing up the chat, singing your praises. So this has been really good. So Carmen, any reactions to what Nate has said and what Krystal has said? Anything you want to add?
Most definitely. I'm also watching the chat, and that's beautiful. I love this engagement. To everyone's point about building trust and the word relationship, I'm definitely harping on that. The collaborative end to our name at NBEC is because we're trying to foster a network of organizations, subject matter experts, researchers, advocates. I mean, everyone who is a leader in this space, and continue building relationship. So when we're out there working with community-based organizations, I mean, sometimes we've been building relationships with these individuals, with the individual community leaders for 5 and 10 years until we have this opportunity to bring them in and then share resources and really blow up the ideas that we built together. So just really reflecting on relationship. That means whatever role that we're playing, if we're in community with these people, remember their names, remember their faces, you know, reach out during hard times and good times. Holler at them when you see them at the gas station or the grocery store. I mean, those are the type of ongoing real relationships that can make these type of partnerships work and be fruitful for health equity.
I love it. I love it. Nate, I'm going to come back to you. And thinking about, you know, what Carmen said as it relates to kind of relationship building. And I know you have to do a lot of that in your work, as in those that are listening. Nate is a peer-to-peer support person in his local FQHC, his health center, and does a lot of community work with the kids. So any last kind of insight you want to give us around relationships and that kind of co-design with community before we kind of proceed to the Q&A, which I know people are really excited to get to?
I feel the key to building relationships, trusting relationships, is not let your occupational title be who you are. Lead with your heart, think about feelings, and share who and what you are and your experiences. I mean, a lot of times people want to throw a title around. I'm the CEO of this or president of that. I don't care about that. I care about the person. I care about where you've been and how can we connect. And I think you build strong relationships if you look at it that way.
Love it. Boom. I wish I had a mic to kind of drop. So, well, thank, all three of you for really being so transparent and sharing with us listeners. I hope that you guys got as much that I received on this panel. And so now I'm going to go hand it off to my colleague, Dr. Zandra Glenn. Dr. Zandra Glenn is our Value and Delivery Officer at ATW Health Solutions, and she's going to facilitate some Q&A. And so, Dr. Glenn, I will pass it off to you.
Yeah, thank you so very much, Desiree, for leading that panel discussion. And wow, just a warm thank you for Nate and Krystal and Carmen for really sharing your expertise and just really helping us understand really what needs to be included, as a part of working with communities around equitable healthcare measures. I just want to summarize a little bit of what I heard and some of the major things that I heard from you guys. Carmen, I heard you talking about when starting this work, you have to start with patient experiences. And the fact that that's not the norm should be upsetting to all of us. One would think that if you're starting work within a community, you're going to start by having conversations with those community members and talking about their experiences. That's not the norm. And that's definitely the place where we need to start. And we have to honor the community experiences. I wrote that down as a major takeaway from what I heard from Carmen. Krystal, what I heard from you is that we really have to understand the dynamics of the community, the roles that people play, their relationships, their obligations, and the purpose of those individuals. And if we don't have that clear understanding, then it's almost impossible for us to have an impact within that community. So really understanding what needs to happen or what is actually happening and what people, what those experiences are, what the dynamics are for that community. And then Nate, Val, you were really powerful. Just some of the really powerful ways of establishing some of these equitable partnerships is we need to be in partnership with these people. We can't just tell them. We need to be a part of who they are. We have to understand. We've got to talk to them. We have to have those relationships. So I was just really excited about some of the major things that we heard from our panelists. And our question to run on is back on this slide. And what we really want to do is give everybody an opportunity to be a part of this conversation. Everybody that is on this call is within a role. They have a role within their organization. They have a role within their community. And we want to find out in your role, in your chair where you sit and the job that you have, what can you do to make sure that we include patients and communities as equitable partners within healthcare measurement. So I'm hoping that we can get at least 3 people to speak. Just share with us your name, and you can just raise your hand. If you could just raise your hand, we'll call on you one at a time. I'll keep my eye on the clock, and I would like to hear from at least 3 people. But in your role, what actions can you take to include patients and communities as equitable partners? As we get a couple of you in the queue, we do want to start with Aaliyah. So Aaliyah, I was about to call on you. So I'm so excited that you actually raised your hand first. Aaliyah was actually a part of this body of work. She's with the Asian Health Coalition. And Aaliyah, if you could just share with us a little bit about the role that your organization had as a part of this body of work, and what nuggets would you like to share as to how patients can be included as a part as equitable partners within healthcare measurement. So we'll go to Leah, and then I would like to get a couple of other hands in queue so we can go ahead and have a few of you comment on that. So Leah, let's start with you. What are your thoughts?
Absolutely. First, thank you to all the panelists. It was great hearing from all of you and your expertise. And so my name is Aaliyah Southworth. I am our Senior Program Director of Health Promotions at Asian Health Coalition. And I echo everything everyone else says, but some other things to add and things that I'm doing, in my role and our role as our organization, the community, is really working with those community-based organizations faith-based organizations, those community leaders. And that really amplifies, your bang for the buck, so to speak. So, by working and collaborating with those community-based organizations, you're able to really get perspective of multiple communities' voices. So we work primarily with the Asian American and African immigrant populations, which have multiple different ethnicities kind of within that, much like other communities. And so by working with these community-based organizations, we're able to hear from multiple ethnicities. So, the South Asian community, the Chinese community, the Vietnamese community, and really be able to act almost as that meeting place for all of that information, for all of those voices, such as with our survey that Vanessa was talking about in the video shown. We were able to get all of that data and the information and do the survey among these 9 different ethnicities in over 3,000 individuals. And then we're able to take that data and help be a voice for the community to, for this project, for, bringing it to federal funders and really, making that difference. So I think that, working with the community-based organizations, being able to kind of expand the way of a way of thinking of how you can include those patients. So that can be through data, that can be through having them be a part of, the table at these FQHCs or at these healthcare measurements, but really just working with the community in general.
Yeah, and I do see Wendy's hand, and Wendy, I'm definitely coming to you, and I'm hoping we get at least one more person. But Aaliyah, before I let you go, you say work with the community partners or collaborate with them. That could mean a long range of things. When you say work with someone or collaborate, that could mean a phone call, that could mean let's go to lunch and I've collaborated with you. What does that really mean for true partnership, true collaboration? What does that mean to you? If I can get an answer to that, and then I'll go on to Wendy.
Absolutely. So to me, that's, a reciprocal relationship. So, it can't at first, it is definitely, you have to find your in. And so maybe that is a phone call. Maybe that is attending an event they have. Maybe it is a lunch, of an informal of, hey, this is what I'm working on. Like, I really, I'm not from your community. I'd really love to hear more about, this. So it really is different. There is no one kind of prescribed way to form those relationships. But it's, being the personal, putting yourself out there and building that trust, so starting with that phone call or that email, or having that meeting, going to an event of theirs and, talking afterwards, whatever way you can, just to get that kind of initial in and start that conversation is the most important part.
Sounds good. All right. Thank you very much for sharing that, Aaliyah. I really appreciate you being a part of sharing with us how your organization is really working with communities to include them within your healthcare measurement work. Let's go over to Wendy. Wendy, welcome. Thanks for coming on the call. If you could just share with us briefly the organization that you're working with, and then in your role, what actions do you plan to take to include patients and communities as equitable partners?
Hi, everyone. This is Wendy Nickel. I'm the president of the Healthcare Improvement Foundation in Philadelphia, Pennsylvania. And the work we do is working with public health organizations, community-based organizations, and healthcare systems to address really complex healthcare challenges. And just a couple of ways that we are trying to authentically co-design and co-create with partners is one, we conduct the regional community health needs assessment in Philadelphia every 3 years as required by the Affordable Care Act. And in doing so, I think many of you probably know that you have to collect a lot of data, and much of that data is pretty quantitative. And we really feel as an organization that it's incredibly important to get the voice of the community and the voice of the patient in understanding what the priority healthcare needs are of those communities. So we actually go out and conduct listening sessions. We do focus groups, we do town hall meetings, and we typically do them in, we go to the community. We don't request that the community comes to us where it's convenient for us. We believe that we need to go to the community where they are and better understand what their healthcare needs are. And as part of that, we try to identify some priority populations that typically don't have a voice in many of these discussions around community health needs. So we have some very focused meetings with the disability community, youth advocates, individuals who may be suffering from cancer, the immigrant, migrant, and refugee communities we meet with, and really just try to understand in their own words, what are they identifying as very high priority. So I wanted to share that as a case example. And then one other area that I think is important, because my guess is that a number of us are working on this, and that's the collection of racial, ethnicity, and language data, particularly in healthcare systems. And while it's important, obviously, it's critical to collect that information. It's less about, are we collecting the information, and more about how are we collecting it? Are we collecting it in a way that is respectful, that is preserving the dignity of the individuals that we're requesting that information from? And so that really requires partnership with community to understand, what are the best ways to ask certain questions? What are the ways that we can train our workforce so they're asking the questions in a really dignified and respectful way? And so we have been, really attempting to utilize those learnings and those findings in these different programs that we're working on.
Wendy, thank you so very much for sharing some of the strategies that you all use to engage your partners. And I really liked your final point there about paying attention to how you're collecting data and including, community members to help you understand the best way to get that data and to train your staff appropriately. So I really appreciate you sharing your thoughts. We do have a couple of questions, and I do want to give the panel members an opportunity to respond to a couple of these questions before we run out of time. And let me, my chat is moving so quickly. It looks like I lost the first question here. Let me see if I can find it again. So one of the first questions that we have here for the panel members are, if you could share some best practices and effective ways to gain trust with the communities that you're working with. So they're trying to figure out, what are some of the things that you have found? And I know, Carmen, you mentioned a couple of things a little bit ago, but if any of you would like to come off of mute and share a little bit more on that particular question before we go to the next one. Nate, I see you're off of mute.
I was giving everybody else an opportunity first, as I know I have a big mouth.
Feel free, go ahead.
I feel the whole thing about trying to strategically get information, it comes off that way when you're in the community. I think it's just about being genuine. It's about being there and about getting, that's the only way you're gonna get trust, is being there and being open and being honest. I think when you try to strategize it and you're writing all this down and having a plan, it comes off as that way. And so if you're in the community and it's not like it's work, you're just in the community because you care, then the people really feel that.
All right, so being present, being a part of the community, and not just, going in to get information and stepping out. So, all right, I hear you, Nate. Thank you. Krystal or Carmen, would either one of you like to add to that before we move forward to the next one?
Yes, can I just quickly add on to that?
Sure.
I see in the chat someone who aligned with my thought of funding. Make time in your FTE, make staff hours, make time to do this connecting and relationship building, not assuming that people are just going to do it automatically, but part of being intentional and being genuine is having the time to do it. We are seeking specific grant opportunities that, would support our investment in community-based orgs, not attached to any specific thing, but just funders who also value our desire to build long-term relationships with communities. And I won't say those are always easy funders to find, but knowing where they are and building like a long-term case for your growing relationships and edifying those relationships has helped National Birth Equity Collaborative, and we really advocate for that funding internally and having those extra resources to give to community-based organizations as well. It shouldn't always have to be attached to deliverables when we're supporting others in the community.
Wonderful, Carmen. Thank you. Thank you for that. Let me move forward because I do have another question I'm trying to squeeze in and make sure we have time. This is a really good question. And one of the participants are asking, so all of the learnings and the lessons that you get from the community, how do you get that information to the organizations that really set the metrics, like the Core Quality Measures Collaborative or the National Quality Forum, so or even to CMS? So from the information that you capture from the communities, how do you funnel that up to the larger organizations that are really helping set some of these measurement policies? Would any of you like to take a stab at that?
I'm working with an organization now in Kansas City, and so they hit me up to something I didn't know was out there. I'm not real tech savvy, but they video, like they make these relationships with people and they do like an interview with them in a video, and there is a program that they can put that video in that takes basic certain words out, and it makes data out of it somehow. I don't know exactly how it works, but they was explaining it to me. He showed me a paper of the data that came out of the program from people. So, I mean, they said that they got the cheapest one because it was their first one, but he said it was one that was a little more pricey, that was a lot more efficient, and they were just doing a trial basis now. So maybe in about 8 months, I'll be able to tell you how good that one worked.
That's awesome. And so I'm hearing the use of technology to extract data from a video. What do you do with that data, Nate? How do you get that data to like some national organizations that are setting metric policies?
That, my friend, is the issue.
Yes.
I believe that's where we all hit the wall at in a lot of senses, a lot of times.
All right, and I think that was one of the major things that our person, the individual is asking. Krystal, I see you came off of mute. Would you like to provide a response there?
Yeah, I think, once you're able to build that trust with the community and they see you in the community, they see you maybe at the basketball games or at the arts crawl, or, these are things that where I see some of our teachers or our doctors or some of our healthcare professionals. This is where we see them at and we build relationships with. So once you get there, and even for myself, for an organization, for us to build that trust, we had to be out at the flea markets every Saturday. We had to, give them something in return. I was like, can you fill out this 5-minute survey? And then you get a free coffee or hot cocoa or tea. And how do we get that data to the coalitions that we're a part of that are able to bring us in connections with other doctors or lawyers, with policymakers? And we really had to ensure that we have that trust, and people that come to us know that whatever stories they share with us is going to go somewhere. It's not just going to be left here with us and it stays with us. It's going to be shared. We're going to try and uplift your story and get it heard at different coalition meetings or different demonstrations that are happening in the community. And so if we're able to have the media with us as well on the journey, doing press releases, getting our word out there, uplifting your organization or your effort, it has really given us a voice to really have a platform to talk about reproductive justice, talk about environmental racism, talk about these really hardcore issues with the people that are there that can make the solutions, with our leaders, with our legislature, even with our tribal members, our tribal officials, and also the doctors. Some of our doctors are phenomenal. They go, they have built working groups around alcoholism, where we come together, twice a month, and we talk about what's happening in the community, and everyone that in any department, we kind of just give our feedback on what everyone's working on. From there, I have witnessed people come together, and right now our legislature is happening, and they're here in Santa Fe. They're meeting with our leaders. They're trying to make healthcare affordable throughout our state, and it's incredible to see those relationships being built and community members knowing that their voice is very empowered.
Yes.
But thank you. I could go off, but
no, thank you, Krystal. I really appreciate that. And we only have a few minutes remaining, and I just want to ask you all to answer in 30 seconds or less this one final question. What's one thing that the participants on this call can do today to move this forward? So if you could get everybody on this call to do one thing, what's the one bit of advice that you would like to have every participant on this call do to ensure equitable, including patients, as a part of equitable healthcare measurement? Nate, I'll start with you. I'll go to Krystal, I'll go to Carmen, 30 seconds, and then we'll close out. Nate, what's one thing you want everybody to do?
I would like everyone to go into the community they serve and meet people without telling them their job title or where they work.
Perfect. All right. Thank you for that, Nate. Krystal, what's one thing you would want everybody to do?
And just to go along with Nate, I would also encourage everyone to work out of your heart space in any situation that you're in. Try to personalize every experience that you have when you're out in the community, meeting new people. Really get engaged, and always lead with your heart.
Lead with your heart. All right. Thank you for that, Krystal. Carmen, you get the last word.
Ooh-wee, I would say lead with the money. Okay. In healthcare measurement, I need you all to understand how the measures you're interested in connect to hospital and systems healthcare payment. Because those two links there, that has been one of the most fruitful and quickly moving pieces of this for us. It feels like that is where we can make substantive change in health systems.
Thank you for that, Carmen. All right, we've heard the final word from our three panelists. I do want to remind everybody to please check out our resources. A lot of work has gone into creating these reports. Check out the video, the call to action video. We definitely want you all to do this. We also have a survey that I'm hoping they put in the chat box. Please just take a quick moment and give us your feedback based on that survey. We want to thank all of you for being a part of this event, and I hope everybody learned something. So thank you so much for your participation, and that's going to conclude our event. Don't forget to do the survey. Y'all have a great day. Thank you.